psychology, there is supposed to be a management of authority, but of course there's inferred authority going to an expert. And so how do you manage it? Gosh. You know, how I practice now, and there's many books about this in psychology, about how you come into the field trying to be very evidence-based, trying to be very protocol-based, trying to provide evidence-based treatment, and having that be very celebrated and validated and considered good care. And what you find after working for many years is you start to put that away, and you start to sit with the person, and the therapist, the psychologist, and the human being that you are is truly becomes one instrument. You stop thinking about, oh, I need to bring that DBT skill in, or I need to do this CBT thing. And so really, I feel like as a very mature therapist that's been doing this for many years, and I'll join you in your woo-woo to some degree. Not that it's woo-woo, but what many people would consider not woo, would consider, why are we having this conversation? Like, what is this guy talking about right now? He's not wrong. There's the most therapeutic thing I do is hold the vision of that person well and thriving when they cannot. That's really the strongest thing I do. And I think that for psychologists who are struggling still within the system to try to provide this standard of care, right? And that's a really difficult thing for them to do, to really truly sit in the room with someone where they're at and hold that vision for them as they guide themselves through that journey. And a lot of what I do is point out that you already know the answer. You're just resisting what you're experiencing. And then that really helps people find their way.